Okay, very exciting to see you all online tonight. Thank you so much for joining us. I'm going to share screen and give you a brief introduction to the New Economy Network Australia. Many of you are a lot of folks joining us tonight who are new to NENA. So bear with me while I try not to mute myself again. So I'm just going to give you a very brief introduction to who the New Economy Network, or NENA, is. We're actually about to have a new look website, so you'll probably be some of the last people to see the old version. But the New Economy Network Australia was formed a couple of years ago, and our main mission in life is to bring individuals and organisations and groups around Australia together who are committed to working to transform our economic system so that achieving ecological health and social justice are both our core objectives and the foundations for a healthier, more just society. NENA is completely volunteer run. Myself and Morgan put together a wonderful conference in 2016, and 150 people came, and that was our beginnings. We had a platform of inviting people to give us their ideas about whether a civil society network was of use. And we agreed that whilst Australia has a range of incredible people, thousands and thousands, dozens of thousands of people working across a whole range of sectors on important issues that are transforming the system, what we felt we needed was a space for people to work across different sectors and silos, and to really come together in solidarity as a peer-to-peer learning space, as a community of practice, and eventually, particularly this year, as we're building our first civil society strategy for a new economy, really hoping to bring people together to start forging a shared vision based on the practice we already do and the things we already want to see strengthened, but also seeing all the things that we'd like to change and transform. The only other thing I'd like to say about NENA is we've tried to build this cooperative. We're now a registered or incorporated cooperative. We've built our cooperative on some pretty cool distributed governance efforts. Nothing is perfect, but we are literally created so that we have a whole range of hubs, geographic hubs spread around Australia. Any NENA member can create a hub that they can come together with other folks, work, share, and break bread together wherever possible. And we also have sectoral hubs, not so much to continue the silos of work that we already do, but to ensure that people like yourself with expertise in all manner of different topics can bring that expertise together with others who already work in your sector, but also share your ideas and knowledge with other people across Australia who care about shifting our economic system. But the only other thing I would love to draw your attention to is some of our events. As I said, NENA has been running now for a couple of years. We're all volunteers, so we're growing swiftly, but also steadily and slowly. We have monthly webinars around different kinds of topics, and you can find information on our website on the webinar button. And we're actually in the throes at the moment of bringing together all of our different hubs wherever possible. And again, everyone's a volunteer doing this on top of normal work. So we're very grateful to anyone who's made time so far to provide input to our gathering of ideas for the civil society strategy for a new economy. If you're interested in contributing and haven't already, if you're not a NENA member, you're still very welcome to share your ideas with us. We're going to be starting some surveys and other exciting ways for you to share your ideas. And the button on the homepage is right here. And despite COVID, we're continuing with our plans to run our annual conference. Our conferences attract anywhere from 200 to 400 people a year. We had one in Brisbane in 2017, in Melbourne in 2018, in Perth last year in 2019, and we were heading for Newcastle in the 20th to the 22nd of November. I'll just click on the little button there to show you the conference page. If it turns out that it's not safe for us all to come together, things were looking good, now not so much, we may decide to go online. And the reason I'm plugging the conference is we're inviting proposals from anybody who's interested in the issues. You don't have to just be a NENA member. Do have a look the closing date for sending us your ideas to run workshops, trainings, presentations about academic research, anything really. The closing date is the 10th of August. So do have a peek at that. And why would you be a NENA member? Well, it's a way of working in solidarity with others. You receive the thrilling weekly updates that we send through, just one little summary of all the webinars and activities and meetings. You can get on the NENA directory and promote yourself, your initiatives. And we've also got a rather amazing New Economy journal, again, run by some volunteer NENA members. It's really turning into an amazing, every 2 months, some very professional and excellent content. So I think that's probably all I wanted to say about the New Economy Network Australia. You can find most of the info you might need to get involved or become a member on our lovely website. I'll now stop sharing. But again, our vision is to bring as many people together as often as we can to share information and to support each other's initiatives. So if you've got ideas or you would like to join a hub or become part of an existing space, please let us know. But different ideas are bubbling up all the time. And we're super excited about the many groups that we're collaborating with at the moment. I think that's about it from me. I might now introduce Clare Mullen. So as you saw, the overview of the hubs is, the intention is to have people, you know, most of us are really passionate about our areas of work, and the hubs offer you, the sectoral hubs offer people a way to come into NENA through their own love of their work or their topics, find other folks doing stuff, and then perhaps wander off and explore other hubs and ideas and areas as well. And so Clare Mullen has very kindly put a hand up to try to begin creating a health hub where folks who are interested in human health, whether it's your inner dimensions of mind, body or spirit, your outer dimensions of public health policy and issues, can come together. So I'm now going to step back and be in the background if anyone needs me, and I'm going to hand over to Clare, who's so kindly organised our event tonight. So over to you, Clare. Thank you.
Thank you, Michelle, and hello to everyone. It's very exciting to see so many people who share an interest in this topic. As we get started, I'd like to take a moment to acknowledge the traditional custodians of the land across Australia, or the very many lands across Australia that we are meeting on today. Here, in my corner of Australia, that's the Whadjuk people of the Noongar Nation, and I'd like to pay my respects to the elders past, present and emerging. As Michelle said, the reason that I got involved with NENA is that I had been doing some work in the health space and increasingly had a sense that the economic environment that we live in and that we work in was coming up again and again, either because people were talking about how they work or how our food system is organised and so on. And so I was drawn to NENA and managed to be in Perth when the event was happening last year. And then a few of us, so there's been a few of us that have been getting together to kind of explore the possibilities of seeing whether or not we can get a nascent health hub together. So if you've got the screen set up with gallery view, you might be able to see a few of these people. So we've got Rashmi Patel, who is an anaesthetist. We've got Alison Kemp, who I think is on here. She's a dietitian. We've got Chris Henderson, who's on here too, there we are, I can see Chris, thank you, who's a functional diagnostic practitioner, and myself, who comes from a kind of community and engagement background. And we really just started to have some initial conversations, and we realised that what we wanted to do was really bring more people into the discussion. The sorts of things we've been exploring so far are quite wide-reaching, but it's very early days. And so we've talked, as Michelle said, about human mental health, physical health, spiritual health. One of the documents we've had a bit of a look at is the WA Aboriginal Health and Wellbeing Strategy, to help draw in aspects of cultural health and also understand the relationship that there is between an individual human and the humans in community, and also our relationship with the planet and its health. And so we really are, if you like, just before the start of the journey, and so we are delighted to welcome so many people here who might share that interest. And we will be hosting another event in about 3 weeks' time, when we hope to get people together to start to explore how could we work together and achieve things that we might not manage to do by ourselves. So I'm so excited to get on with the speakers this evening, and I'll introduce them all and then we'll hand over to our first speaker. But I am delighted that we are able to hear. Really, it was to try and give, when we started to think about what do we want to focus on for the Health Hub, we realised that it can mean lots of different things. So we wanted to try and have an event where we could help people have a picture that would help give us something to kind of focus our attention on. So I'm delighted this evening to be joined by Shelley Bowen, Jon Anstey and Kerrie Oakes. And across the three of them, I think we're going to hear some really, really interesting perspectives, both from, if you like, some of the concepts and ideas about community and individual health, about the setting within which those health activities take place, so the potential for the social markets that we'll hear about from Jon, and then a couple of very practical examples of some things which are happening right now on the ground that can act as a bit of a beacon and a bit of a shining example. And I'm sure that there'll be many others right across the people who are joining here this evening. So the way we're going to run this evening is that we're going to hear from each of the speakers in turn. So we'll hear from Shelley, and then Jon, and then Kerrie. And we would ask if you, just from a time management point of view, if you've got questions, maybe pop them in the chat or hang on to them, because after everybody's spoken, which will be, they'll have about 15 minutes each, then we'll open it up for what I'm sure will be a really interesting discussion and Q&A. So I will, at this stage, hand over to Shelley and say welcome so much, Shelley. I'm looking forward to hearing from you, and over to you.
Yeah, lovely. Thank you so much, Claire and Michelle. Absolutely thrilled and excited to discover NENA, actually. It couldn't be better timing, certainly for me and for the work of Health Futures Australia, which is really quite timely. I'm coming to you from Wathaurong land in central Victoria, and I want to pay my respects to the local people and to elders emerging and also past and present. So here is an article that sort of emerged last week in the Courier. Yes, it's first observation, the Courier newspaper is surviving, a country regional newspaper. Second observation is when I was rung from a reporter saying, Shelley, what are we going to do about this? I've just driven along Howard Street in Wendouree, and I've noticed over 20 takeaway food outlets. And he said, and I've clocked that these 20 takeaway food outlets are within a 1 kilometre radius. What's going on? And I said, what's going on? And you can see this sign here. Not only is there already 22 takeaway food outlets, but a new one is opening next week. How is this possible? What's going on? We also see in Wendouree a road called Howard Street that divides the community. On one side of that road, we have extraordinary wealth and probably some of the wealthiest houses around Lake Wendouree in regional Victoria. On this side, where I'm coming to you from, of Howard Street, is possibly some of the poorest parts of our state in West Wendouree. So what's going on? Like, how on our watch have we started to see this kind of community normalisation emerging? And what are we possibly going to do about it? So as Claire mentioned, I'm Managing Director of Health Futures Australia. I'm a breakaway or possibly a refugee from government. I spent nearly a decade as the state's public health advisor in Victoria, and yes, am I happy that I'm not there right now? Certainly am. And I've always been a preventologist at heart, so I'm a public and population health person. So I'll frame really the next 15 minutes or so around public and population health and the need for prevention, because prevention, whilst we have a very robust public health system, it is by and large focused on care. At the moment, we're seeing public health rise and do its very best in terms of health protection. We've got the public health effort in full swing, and no doubt under extraordinary pressure and to some extent possibly suffering from years and years of neglect and investment. But there's another part to public and population health, and that is prevention. So what have we got to do to keep the majority of the population well for as long as we possibly can? And that's really where I'll frame what I'm going to talk about today. So about 2 years ago, actually probably about 4 years ago, I started to, see the light and think, whoa, I'm sitting in government policy, enjoying what comes with that, power, resources, an opportunity to make a difference. But as anyone that's worked in government, probably any part of government, certainly state government, those policy of windows of opportunity are momentary. So when do you get that kind of combination of the people, the politics, the processes, coming together so that you can create something extraordinary. I decided to step out of government and set up Health Futures Australia. So we're a health promotion charity, and really have done this with the idea that, okay, the next era needs to be one that is focused on well-being. So how might we transform from where we are, from what I see largely as weak prevention in the system, to the reimagining of the system and how we can be producing health and wellbeing outcomes. So Health Futures Australia, Professor Rob Moody is our board chair, another kind of periphery, a bit of a public health maverick. And Jon, who will speak shortly after me, is also a part of the team. So we're trying to actually offer an alternative in the system to say, okay, prevention, health promotion, when it works, it is effective. But why can't we get it to scale? Why can't we get it to the thresholds that we need to get population health impact over the long term? And I've spent most of my career building what I consider to be extraordinary interventions with many people. But those extraordinary interventions disappear with the next political change, the next political cycle. And for someone who's worked in this space, that is often, every 3 or 4 years. So how do we invest in population health and prevention for the 7, 8, 9 and 10 year timeframes that require? That certainly is the critical question. So wellbeing economy, bring it on. We've been focused on it for a couple of years, and we've really oriented Health Futures as a mission in and around where can we hang our hat, where can we plug our framing into. And I appreciate everyone on this Zoom session is well versed in most of these concepts, ideas, and individuals. But what I love about what I'm seeing emerge, and I will emphasise globally, not necessarily in this nation, is where that politics, that signalling of the system that we can be a wellbeing economy, we can build economies that thrive, is occurring. We're also seeing, of course, there's extraordinary, and it just so happens to be many women, the female economists, the Catherine Trebecks and Kate Ratworths, really speaking to the type of economy that we want. So I started to think, wait a minute, how can I, as a diehard public health person, how can I, in the world that I inhabit, which is highly evidence-driven, highly evidence-based, how can I contribute to a wellbeing economy? How can Health Futures contribute to the kind of future, and one that actually creates a very different market for prevention, where health and wellbeing is front and centre? Sustainable development goals, and I know, powerful, and I keep reminding, no matter where we work, in the smallest of communities, the largest of regions in this nation, we do have a mandate, we do have a framework, we do have measures. Because often what I will be in conversation about, and at times debate about, is, Shelley, if we're going to start to worry about wellbeing, like really, isn't it a little bit airy-fairy? Like really, where's the hardcore of measures of where we'll reach kind of population health attainment? The fact is that the work has been done. The Canadian Index of Wellbeing beautifully sets out 8 domains of where we can act. And each one of these, if you are truly and deeply engaging with communities, regions, organisations, we start to see these come to the forefront. They're, for me, powerful guides and measures of where we can act. Clearly, for me, I've focused quite a lot on healthy populations, good health and wellbeing. But even if you look at the Sustainable Development Goals, number 3, good health and wellbeing, we're seeing a bit of a heart monitor there. So as we know, good health and wellbeing requires a whole lot more than a clinical system. It requires the majority of these 17 goals. So how do we make sense of this? How do we not go down the rabbit warrens, which I feel I've spent most of my career having to go where the political momentum has been, where the investment has been, obesity, and whatever it might be? How do we truly understand the complexity and navigate this like never before? Because it's certainly the time for us to do this. So in this, you'll hear me keep asking this question, how might we? And I was thrilled to hear Michelle's introduction around the kind of agile and the way NENA's positioning itself. That's certainly something that I discovered. How do we bring the best of public and population health science and theory together with social science, theory and practice, social innovation, and of course sustainability and environment theory and practice? And this is very much when you ask a community now, okay, how are we going to develop a strategy for obesity prevention? What you'll hear powerfully is we're going to deal with climate change. And so how do we kind of navigate and build these dynamic platforms with so many diverse actors and stakeholders in communities? I think is not only our our challenge, but it is our extraordinary opportunity. So enter social innovation and the era for social innovation. And it's extraordinarily challenging, certainly for me as a public health person. I love my science, I love my data. But you know, how useful can it be when we are facing what we're facing right now? But I love the emergence of design thinking. I'm enjoying and deploying a whole range of empathy-based, human-centered design to actually elevate the power of public and population health. And we're getting some fantastic emerging ideas. And, you know, we will often be standing there. It's almost like standing on the cliff thinking, oh my goodness, am I going to fall off here because it's so damn complex? Or are we going to be able to hold this up and navigate something quite extraordinary? So let me share with you a prototype that has emerged as one example. And it's that moment when you're working with a community. And in fact, this is a region in the Central Highlands of Victoria, and a community with about 15,000 population, the Hepburn Shire. For those that may know of Daylesford, it's, you know, not only a community with spas and hatted restaurants and organic farms, it's also a community that really probably a third of the community, just over a third of the community, earns an income of around $40,000 a year. So how might we design or utilise the power of a food system to actually build employment, to tackle mental health and well-being, to tackle overweight and obesity? How are we going to pay fair prices to our local farmers, our small regenerative farmers? How might we build healthy and sustainable protein into our diets? And how might we think about the 12 schools in this community and the youth population, which comprises about 50% of that school community? So how might we actually turn around the fact that young people are eating, you know, very, very little vegetables? So how might we actually, you know, be able to engage young people in designing their own healthy food system, but also designing the jobs that they'll have in that food system, whether it be in aquaculture, any of the applied sciences, in hospitality, in building of a sustainable facility. So we've prototyped this over a 10-month period with a range of community leaders. This is a community that's declared a climate emergency. And I will specify the entry point for us, Health Futures, in being the kind of holders or the stewards powering this design process. The entry point was an obesity strategy. So here you go. This is the future. This is what an obesity strategy, an obesity prevention strategy looks like. This is what a mental health strategy may well look like. This is what a youth mental well-being strategy might look like. So community design, we have a range of commercial partners and the local schools, of course, young people, council. We're really lucky to have a global vegetable seed producer located in this community that's ethical. That's one of the biggest in the world, family owned, and is a key partner to this initiative. So my point is, this is such a stretch from my health promotion world. This is such a stretch. You know, I've been trained to really operate in the healthy lunch space. How do we? You know, I often refer to the healthy lunchbox strategy as both you know, a moment of, you know, how do we get the whole population just to have a healthy lunch? Well, you know, we've got to move beyond that. How do we actually have layers in it? How do we bring in the circular economy? But I think this is even deeper than that. How do we actually create sustainable, healthy food systems with our communities? And more importantly, how on earth do we get them funded sustainably? And how do we bring them up so that within, you know, 3, 4, 5 years, they are in fact sustainable, financial, commercial, and they are the future. So our vision is that we're setting this one now, we're learning a lot, it's highly complex, highly iterative, but we see a vision for social franchising. We see a vision that, you know, for me nationwide, to see 100 shifts. This shift, as it's been modelled, really will create probably 16 jobs within its first 12 months. You know, that's powerful for a regional community. So how might we take these types of innovations to scale across our community so that they're not going to be here just for the term of funding, but for the long term? So really the journey for Health Futures has been very much confronting, and I love the work of Otto Sharma and the Presencing Institute. In fact, that's where I met Clare Mullen a couple of years ago over Fremantle, and investing in you know, those deep questions really in terms of ecosystem thinking. You know, how do we move from the ego to the ecosystem economy? What is an economy? And I think that the the perfect mandate is the wellbeing economy. And certainly at Health Futures, we are intending to do all we can to shape and show what's possible around creating wellbeing communities and wellbeing interventions. I think this is, you know, it's kind of hand on heart, the responsibility and the commitment certainly that we as a very small team, we really want to grow and really want to be a part of. So thank you.
Wow, Shelley, thank you so much. That was an awesome canter through from where many of us still are and where we've been through to a big vision for the possibilities of the future, as well as some practical examples of work on the ground. And you left a big question, so I was really, I love that kind of cry for action. I think now is the time. I can feel, I get goosebumps when I hear that, so I hope that people are excited too. So now then, we're going to go on to, and I'm going to invite Jon to, Jon, like Shelley mentioned, is also from Health Futures Australia. He comes from quite a different background with, as I understand it, Jon, you're a lawyer and with a business perspective. And Jon's going to just expand a little bit more about some of the market environment that Shelley alluded to in terms of how we start to move to that whole of economy, whole of community kind of approach. So don't forget to hold on to your questions for Shelley. And Jon, over to you.
Jon was having some connectivity problems. I wonder if we have lost him. He's still there, but we can't hear him.
Thank you very much, Claire.
It's not happening, is it?
I don't think so.
Would we like to move to our next speaker, perhaps? And I can send Jon a note?
Yes, why don't we try that?
Yeah.
And so then I'm just going to check. Yes, there we are. Kerrie is there. So I'm equally delighted that we are joined by Kerrie Oakes, and Kerrie is going to give us again quite another perspective on this concept of human health and a wellbeing economy. Kerrie is one of the founders of a community-based approach to herbalism clinics. And so Kerrie, please feel free to do a bit more of an introduction about yourself. I want to make sure that's done justice. And we'll come to you, Kerrie, and welcome to you.
Thanks, Claire. Hi, everybody. I hope you can all hear me, and I hope my internet holds out. So yes, I am currently a herbalist. I have previously been a teacher, youth worker, rape crisis counsellor, public servant for 15 years, whole range of things. But about 3 years ago, I started work as a herbalist, qualified here in Australia. And one of the things that I found out fairly quickly was that I couldn't possibly charge the fees in my community that many other people were charging for natural health practitioners. It just wasn't going to be sustainable as a business. So that's kind of the beginning of my journey, which I'm going to share a little bit about now. So just bear with me while I share my screen. There we go. So basically what I've done is a bit of a journey of community supported herbalism. And at this stage, as far as I know, we are still the first and only community in Australia that has a pure community supported herbalism approach. There are a range of other models, but the one that we're doing here in Somerset is a little bit different. And then cooperatives and health hubs. So before I start, I just want you to imagine you're a 38-year-old male, you've just had a stroke and a heart attack and have been diagnosed with ongoing atrial fibrillation. There's no public transport where you live, but you have to attend weekly rehabilitation at the nearest public hospital, which is 105 kilometres from your home in one direction. You're on unemployment benefits, pending transfer onto a disability support pension. You live alone on a rural property, and you've been told that you will never work in your chosen trade again. The highest level of schooling you've got is Year 9 plus your trade certificate. And I mentioned you don't drive. And the nearest TAFE, if you decided to do retraining, is 105 kilometres away as well. Or again, imagine you're a single parent, constantly juggling your budget to afford the rent, buy food for your children, pay for your electricity. Your car has just broken down and you can't afford to go to the mechanic to get it fixed until the next fortnight. You've just been contacted by your son's school to say he's had an accident and you need to get him to Gatton, which is about 95 kilometres away, for an X-ray. So what do? How will you get there? Who can help? What about the medications? What specialists are you seeing? Where do you find your money for the rent, the food, the bills, the extra medical expenses? Here's the maze that you have to go through, trying to get the sort of medical care that you might be looking for. But what if it was different? What if in your own community you had educators, you had food growers, you had people who would be prepared to transport you, you had crafts people who would be prepared to make bits and pieces, you had sponsors, you had managers and practitioners all doing various things. And this is the model that our herb clinic is built upon. Which also leads me to ask questions, what is it that determines our health? It's not just our physical health, but a whole range of other things called the social determinants of health. Education, employment, the social support you've got, the housing that you've got, the opportunities you have, your working conditions, your transport, your built environment, your culture, your early life experience. And these factors have a whole range of health outcomes, which you can read quite happily there, and I'm sure you can imagine lots of others. But the interesting thing is, if we address the social determinants of health, at least 500,000 less Australians would be chronically ill. There'd be at least a $2.3 billion reduction in the annual hospital costs that we pay, and there would be 5.3 million less prescriptions for drugs on the pharmaceutical benefit scheme. And these are government figures, not mine. So this is where I started my journey. So the Somerset region, as you can see, is a little tiny green spot, the southeast corner of Queensland. We've got 5 major towns, but there are about 35 distinct little communities. They might only be a blip in the map, but people there call themselves a community. There's a population of over 26,000 at the moment. So these are some of the sorts of demographics that, again, when I was looking at it going, well, who would I be working with as a herbalist? What capacity did they have? The indicators of health, and these come from our state health department, at least 85% have at least one of the 4 risk factors. So they smoke, they don't exercise, they don't eat a healthy diet, they're overweight. Approximately half have a long-term health condition. 14% cost prevents them from seeing specialists. They can't fill prescriptions. We have to go outside our region to get our health care. A continual barrier is the lack of access to transport. And as you can see, our life expectancy is the 5th lowest in Australia. But a lot of these deaths are related to preventable diseases. We've got a high service demand, but we've got a very low GP to population ratio. Navigating the health maze in our community is quite interesting. So for example, where I live, if I call an ambulance for my partner, I have a choice of 2 different hospitals within the Somerset region, both of which are basically what I would call a staging hospital. He would be taken there for an initial assessment and probably almost automatically transferred then either to Ipswich or Caboolture or even possibly to Toowoomba. Approximately 100 to 120 kilometres away from where we live. If we go to our GP, he refers us to one hospital, but he would prefer sometimes to refer us to a different hospital. We have 3 different ambulance services, 7 aged care services, and when I looked at that, that was 111 beds across the whole region. We're covered by 2 health districts, which means that depending again on where you live, what services are available depends on which health district you might end up being referred through to. We've got 8 GPs, and we've got a variety of allied, complementary and alternative providers, by which I mean exercise physiologists, chiropractors, Reiki healers. I'm the only herbalist. We've got a number of naturopaths. So we've got a whole range of other people. So that's kind of the picture of what we're trying to do. So just to give you a bit of a practical of what we do, if I look at the community-supported herbalism first, when I started my herbalism journey, a friend of mine sent me some information about a thing called a herb bus, which is operating in Atlanta, Georgia. And the herb bus is a bus, and it travels through the suburbs of Atlanta. It was set up after Hurricane Katrina. And basically the herbalists there go out in the street with packets of herbs, and they sit and invite people to come along. And people will come and have a consultation with the herbalist. All of the herbal materials are donated. The herbalists are volunteers, so they don't receive anything for their work. So it's pure community supported. Here in the Somerset, so when I run my clinics, I now operate 5 different clinics in 5 towns across the community. So once a month, I visit each of those 5 clinics, and I will do full-scale community, a full-scale consultation with people for a flat rate of $20. The average, and I just read a research paper on this this week, the average cost for a naturopath or a herbalist in Australia is $103. We're not covered by health insurance, we're not covered by Medicare. So it's a flat rate, $20, and the reason I started charging $20 was because I had a 3-cylinder car, and it took me $20 worth of petrol to get from one end of the Shire to the other end of the Shire and back home again. So basically, if I saw one client, I cleared my costs. All of the commercial herbs have been donated to the clinic by the companies, or I purchase, or they purchased for under wholesale cost. So I have arrangements with 3 of the major herbal medicine supplying companies. The real vision is that eventually all the herbs that I use in the clinic will be grown within the Somerset region. So 2 years ago, I started recruiting local gardeners, and thanks to the drought, we're not doing quite as well as I'd like to, but the idea is that our local gardeners grow herbs. Sometimes I put out a call then, hey, has anybody got California poppy or chamomile or whatever herb growing, and I'll get people giving them to me, sending them to me for me to use. The seeds were donated. I received, we've had grants from people. Some of the packaging that I use in the clinic has been made by our local craftspeople. So I guess it's kind of that, you know, imagine you're sick, you go and see somebody. For a start, you're getting a consultation or you're getting a service at a price that you can afford, but you are still with that feeling that you're contributing. But then the little extra touches that you wouldn't think of. So the packaging, it's made by somebody else in the community who doesn't even know you, and yet they're doing that for you. How does that make you feel? Like, how would that make you feel if you're socially isolated, but somebody cares enough about your health and about you to give their skills? So that then is part of the idea of the community cooperative. So we're planning to launch the cooperative in October. It's going to be earlier this year, but of course, again, you can't have public meetings when you can't get people together, particularly to explain some of these sorts of things. So we're just about to have our first public meeting next week with one of the communities. But I've been talking about this to people with people for 3 years now, so a lot of people that I talk to are fairly familiar with that. So the idea of the community cooperative is that the members of the cooperative are part of planning what the health hubs will look like, what types of services, when will workshops be on, what workshops would they like to see, what information does their community need. So the clinic and the look of a health hub will look slightly different in each of the communities because it will be driven by the members of that community who are members of the cooperative. And the idea with the health hubs being that there'll be a range of services. So there'll be potentially myself as a herbalist, maybe there'll be a massage therapist, there might be the physiotherapist, we might have the local gym manager there, it might be a workshop, it might be information sharing, but also post-COVID, when we can all be a little bit more flexible, even just coming down to the clinic, have a cup of coffee, have a cup of herbal tea, meet with some of the other people in the community, take some time out from your everyday stress or whatever, just to gather. So that's the idea of the health hubs, a whole range of different types of things. So the idea behind our community managed health hubs, integrated health services, and I'm not looking at services that are just natural health services. Ideally, it will be GPs. Last year, I was invited to set up a herbal display at the local hospital, which is quite unusual because it's very difficult as a herbalist because we're not officially part of the health system. So that was quite a good opportunity to talk to health department staff about what we're trying to do. I've seen one of our local GPs at the beginning of my 3 years ago, herbs, yeah, what are they? Then he moved to, oh, yeah, herbs, yeah, don't know much about them, to now saying to clients, no, look, I don't know anything about herbs, but if your herbalist has said take them, then that's fine with me. For a GP who's on the verge of retirement, that's a very big change in attitude over 3 years. And part of that is just, I think, because the community has said this is what we want, as well as we are happy to go and see the GP, but we also want these other things to be available. So the health hubs are to look at that multifaceted. Health is not just our physical body, it's our mental health, it's our social health, it's our environmental health, all of that. The idea then with the community cooperative as people-centred, sustainable enterprises owned and operated by the members. And I think one of the most telling reasons why we should have it is because last year, one of our primary health networks did a survey and found that 50% of the community, 36% of GPs and 59% of allied health professionals and 50%, so roughly half of the people surveyed said healthcare providers themselves are too busy to coordinate care. And yet that's what people often need, is that coordinated approach to care. So that's the direction we're going. Thank you.
Thank you, Kerrie. That there were so many things in there that really make my heart sing. I think when you said about the shift that you had seen in the GP across 3 years from not having that here to, hey, that sounds okay. And the reason is, one of the things you think that might be behind that was that this is the community saying this is what we want. That kind of lifts my heart to think that the more that we can work with community and have people involved and voicing what it is they want to see, is that can affect change. Thank you so much, Kerrie. Now, we think that we might have Jon in as somebody who's dialed in, so we're going to, everybody, and we'll come back to both Kerrie and Shelley for questions. But Jon, are you there?
I am here.
Yeah.
I'm my sincere apologies, everybody. I'm here with you ethereal, if not physically. Claire, would you like me to hold forth just verbally without the benefit of any visual props? I regard visual props as last refuge scoundrel anyway. So I of course exclude Kerrie and Shelley from the observation. Hello everybody. My name is
Jon. Sorry, just to interrupt you briefly for a second. Your audio, the Zoom gods are not in our favour today, but the audio is slightly difficult to hear. So I don't know if there's another patch where you are that you know for sure has wonderful connection, but we might just give it another go because it is a little bit hard to make out.
My only other question too, Jon, do you still have your volume on while you're sitting in front of Zoom? Because it might be an echoing back. You might actually, no, but if you're not connected, I don't know how that's happening.
I'm not connected at all, no.
Okay, you might need to speak slowly and try a slightly better place in your room.
Okay.
Everyone, have your fingers crossed. Let's all send good Zoom thoughts to Jon wherever he is. Come on.
Thank you, everybody. I can feel the love. I really can. Is that slightly better?
Yes.
Okay. Good evening, everybody. I'm on Jarrah country in central Victoria. It's an absolute pleasure to be with you tonight. Thank you very much, Claire, for the invitation. Fiona Armstrong and other friends and colleagues, it's great to know that you're there in Radioland. I have a base for radio, so I'll just hold forth verbally, and you'll get to see my beaming style another time. I'm social and financial markets principal with Health Futures Australia. I come at our work in deep translation change with a finance as well as a legal sort of perspective. I think complements the core focus that we have as a social enterprise ourselves on social innovation. So I'm just going to talk 10 or so minutes about some trends that we are seeing in social finance of social market activity. Finance, as we know, is a means to an end. It's not the end in itself. The end in itself, as far as we're concerned at Health Futures Australia, is building resilient, robust communities through social market creation in this particular context. Finance is the thing that lubricates those markets. Shelley, you talked about a very exciting jewel in the crown, really, we have set up as Health Futures Australia, Shift, the social enterprise. I saw a chat question about what Shift actually does. Well, it's designed to achieve employment, connection, as well as healthy food options for communities. Plus, through circular economy type approach, it aims to capture the value that we can generate from being really, really sophisticated about the way we look at community energy, for example, carbon emission reduction. Shelley, you spoke about how in central Victoria, especially in Hepburnshire, we have a very, very activated community from a climate perspective. Part of our inspiration from a finance perspective comes from a fabulous initiative in California. The California Endowment has set up an initiative that bears some resemblance to Shift across metropolitan Los Angeles. The initiative is called Fresh Works. It aims to plug egregious food desert problems in metropolitan LA, where vulnerable communities don't have access to healthy food options. This is a very significant investment believe by the California endowment. It rests on a basis of some $7.5 million of grant money, but above that grant money, there are various layers of debt. And in total, the grant and debt layers, this cake, if you will, amount to some $132 million. And then on top of that is equity, that is shares that are issued by some of these social enterprises and essentially food outlets that provide healthy food options to disadvantaged communities. There is tax credit funding and various things in the finance mix. And the concept here is that it's a bit like for Health Futures Australia's shift. We're in the game now of soliciting grant money from philanthropics because that's sort of the risk money, if you will, on top of which other people will invest. I talk about debt because debt now is, as we've seen recently in the last few days, with comments by Dr. Philip Lowe, the lead at the Australian Reserve Bank, debt is the thing that we are going to use nationally to finance our way out of the combined and economic crisis that we have. You know that we have relatively low levels of debt by OECD standards, around 30% of our GDP. But we are going debt like we haven't done since the Second World War. Here's the thing, though, that interest rates are very, very low. In fact, they're the lowest it's been since Federation. So you put all of that together, and in our view, debt is sort of looking like an increasingly interesting option on our watch, as we speak, as 50 or so leaders around Australia focused on health. The government just increased in size before our eyes because of COVID by 50% and the welfare state 100%. So we are a unique juncture in time where there's huge amounts of debt financing that's coming our way, and I think part of the challenge for us as an economy network is to think clearly about how we can mobilise that debt for social finance purposes, and social beneficial purposes beyond debt financing of infrastructure, for example, worthy though that is, and I'll touch on that again in a few minutes' time. Shelley Bowen mentioned the Sustainable Development Goals. We are seeing in finance now debt being issued that touches combinations of combinations of the 17 Sustainable Development Goals. A lot of the finance that we're seeing, of course, is climate finance. My interest in part as a climate finance and regulatory lawyer, I work in the energy market quite extensively. So what I'm looking to is to try and think by analogy about the way we can insights or take insights from climate finance into health finance. Bear in mind, of course, what the LAMP tells us about the global syndemic that we face of obesity, climate, and malnutrition all at once. So at a high level as well as in this, there are very significant synergies there. And we see that as coming back down to the local, which shift, because as I said, climate finance through generating biogas for purposes of renewable energy generation at a community level is indeed a future financing option that we have. In the last, I guess, 5 or so minutes, I'd just like to do a bit more on the types of financial players we see. Shelley, you were Westpac Social Change first, so we have the 4 banks that are increasingly under pressure to divest out of carbon or climate activity and climate activities that are disadvantageous to climate. We saw the Swedish Right Bank, the central bank in Sweden last year, divesting out of state government bonds in Queensland and Western Australia. I would love to see the day come we can really take everything we've learned from tobacco, for example, in terms of divest out of companies that peddle the types of junk food that is at the, causing the wave of activity that Shelley talked about in her comments in our region here in Central Victoria.
Now, Jon, I'm so sorry to interrupt you. Sorry to interrupt. I think the gods of Zoom are against us right now, and I think that of what I can hear, that it would be really wonderful if we are able to get this content. I know that there is interest in it, and it would be really wonderful if we might be able to rearrange another time when we can get, maybe even if we record an interview with you that we could potentially make available. I'm so sorry, but it's just becoming quite difficult to hear. So
Claire,
I think
everybody, my sincere apology. I'd love to take up that offer. Let's proceed on that basis.
Wonderful. So we'll pause there. But I think, so I'm just going to put you on mute for now, Jon, but bear with me. So I hope that what you've had an opportunity to hear there this evening is a little bit of a few kind of tasters of some of different approaches, but I think certainly what I heard were some pretty significant threads, and I just wanted to come back and pick up a couple of things that really, again, one of the things I was struck about across both Shelley's and Kerrie's presentations, that and I've been involved in some work that the Australian and New Zealand School of Government have been doing with the Centre of Public Impact about reimagining government. And one of the sort of source texts that's been referred to a few times there is a book called Radical Help by Hilary Cottam, and that really is focusing on the relationships that are at the basis of a social welfare and a health system. And so Kerrie and Shelley, I think you both mentioned it in different ways, but Kerrie, I was really struck by your comment there about, how wonderful is it for somebody in the community to know that there's another person in the community that has gone to the effort and has created that support that's available to them. And Shelley, I was really struck by the relational aspects of, well, so many of the points that you both made around the relationship between the school system, the food system, the health system. So Shelley, I might come to you first and invite you if you've got any comments to make there about the importance of relationships, and then Kerrie, I'll come to you.
Yeah, look, fundamental. I remember doing a presentation. I think it was at the World Obesity Forum. It was in Kuala Lumpur many years ago. And I remember at the end of the presentation, I had a bit of a queue of people asking me questions, and people, I was going through answering them. And someone came up and said, "Shelley, you talk about relationships. You're one of the first people I've heard talk about them as being possibly the major intervention when you're trying to create change and shifts." And it was just one of those moments, and I thought, oh, yeah, you're absolutely right. What I've learnt, and this is such a tension when you're trying to create population health change or any change, to be honest, is the time it takes. And I know that just seems a little cliche, but it's fundamentally really difficult to shift systems if you can't actually, have that handful of extraordinary people working together. In our experience down here, we've tried all sorts of things. You win, you lose. I actually find possibly the system that's the hardest to engage, go figure, on circular economy is the health system. And so, how do we build those relationships when we've got systems that are funded to compete, actually? And the time that it takes, and when we start off our work and we look at methods and we say, okay, we can do a workshop, the sticky note effect, we can do a 2-hour workshop, we can have the sticky notes, we can all feel better about ourselves, and we can kind of, come up with a couple of strategies, but we aren't going to do anything to change the system. I realise in setting up Health Futures, we are quite niche. Work with us, and we're going to create a bit of mess. We're going to create a bit of pain, but we're also we're there to steward, because we're in this with you. We kind of constantly say this. Our hearts are in this too, but work with us, because if we can get to that moment, that threshold where we see it, and that diagram that I showed before from Shift, that moment. There's no one in years I could have. I'm not a I'm not a population geneticist and environmental scientist. It was those guys. You know, it was fantastic. They're the ones that are kind of doing the modelling and the diagrams and going, could it look like this? And it was just one of those moments you go, yes, it could. You know, why couldn't it look like that? And, you know, but that's 10 months of work, which I actually think is quite quick, really. But whenever I see that kind of deep social innovation, you know, you're looking at a couple of years. So try to be someone like Health Future saying, you know, can you fund us to transform the system? Like, who's going to do that? Yeah, can you fund us to produce, you know, X number of healthy lunch boxes? Well, oh yes, we'd love to do that. So, you know, how do you balance those tensions, build those relationships? And, you know, quite frankly, I've come to the point now, you know, how do we inspire collective creativity? That's what it is. And it's kind of classic diffusion of innovation, isn't it? You know, you spend a lot of time worrying about those that just aren't with you. So I'm not worrying anymore. I'm just getting on with it, cutting through, you know, going where the energy is. Quite frankly, if I don't see energy, I'm not wasting my largely voluntary time.
Yep, and I hear you. And Kerrie, I imagine, so I'm struck there because I did think that, Shelley, when you spoke about that 10-month prototype, I did think that's, you know, a relatively short time frame for those deep and deep, meaningful relationships that you're talking about. Kerrie, if I can come to you.
Hang on, sorry, I've got to turn the light on.
No problem. There we are. If I can come to you, you mentioned that you are now at the stage of engaging the community in these conversations, but that you have been talking to community members for a number of years. So I wondered if you just wanted to tell us a little bit more about some of those, that relationship building and those relationships that are at the foundation of what you're doing.
I think one of the benefits of being a herbalist is that we have to build a relationship with our clients. You know, our consultations generally are anything from an hour to an hour and a half as an initial consultation, because what we do is we don't just see health, and this is part of the framework and the philosophy, is that we don't just see the symptoms. We actually see the history of the person. What's their family health like? Where did they grow up? What's their environment like? We look at all systems of their body, so we kind of see and look for the whole person to work out, well, what can we do? And I guess this is then also, it comes down even then to the relationship of the person with herbs. So when I'm picking herbs for a person's formula, I go through and I will pick all the usual suspect type herbs that might be useful. But I nearly always say to a client, now look, here's a range of herbs, you pick one of them, so that the client themselves are picking, because that relationship is also important. I think though, in all the work I've ever done, I've always only ever seen relationships as being, because we're people, we're humans, we need some form of relationship, and we are all part of that whole, regardless of whether we like it or not. We're all in it, we're all on this same lifeboat, really. But then the research is showing, so for example, in France, about 2 years ago, there was research done in a GP's office, or the French equivalent, and similar research done in the UK, where for some reason, and I guess it sort of floors me, they decided, well, what if we got people to connect with each other? They started to get healthy because they were connecting with each other. And I guess for me, again, I've just always thought, but that's how we do it. And I think that's been part of the benefit of me not coming from a health background, but from a community development type background, where again, I was encouraged to look around the whole community and look at the strengths of the whole community in its entirety, and knowing I can do some things, but I can't do other things. So, you know, I can't manage a budget for the life of me. So for example, I had a client only this week contact me and say, hey, Kerrie, thanks, I got my package of herbs. Now, how do I pay you? Oh, yeah, I need to actually give you my bank account. Yeah, here's my bank account.
That's right.
It's fine. Well, she then had to email me and say, now, Kerrie, how much do I owe you? Oh, yeah, right. I'm not a business person, but that relationship side of things is fine. So that's kind of where all the skills that I need to run the clinics are in my community. My job is to find those skills.
Wonderful. Thanks so much, Kerrie. Now, and I will give you a heads up, we're going to open up for questions now. We've got a bit of questions before we finish in about 20 minutes. Shelley, we've had a question come through for you from Tracy. And the question is, what is the prototype proposing to do? Now, if by chance you're talking, you're still on mute.
No, that's right. Yeah, just put that one out. Okay, so I thought I'd just pop it because I saw that question. Great question. If you're thinking you're going to change the world, then you need to kind of explain how. So fundamentally a social enterprise model, and it's located at a school, so it'll be a new purpose-built facility. It has a commercial kitchen, and it will be attached with a aquaponics facility which produces fish and vegetables and herbs. That facility will be a commercial facility as well, so it'll be selling to local restaurants, and also we have it's a farm gate, so we have a lot of local farmers coming in with their produce, and that will be redistributed out to the community in vegetable boxes. We have the biogas facility in design, and that'll be using largely commercial food waste and to power the facility. And we have big dreams and hopes there'll be enough power over time to power the school, the high school, Dalston Secondary College, which has about 500 students. And we have the commercial premises will have a healthy lunch kitchen. So in fact, we aim to produce I think year one, we've modelled around 24,000 healthy lunches, so largely vegetable, plant-based food, up to year 5 producing around 72,000 healthy lunches. And it's modelled on demand canteen use, but a very, very different menu to the canteen offerings now. So it'll be quite a big transition. Importantly, it builds on a program called the Cook, the Chef and Us at the Dalston Secondary College, which has young people coming through learning hospitality, training through TAFE, skilling up in hospitality. So it's extending this, and with our commercial partner, right?
Sorry, Shelley, would you mind just holding your mic consistently?
Oh, sorry.
You're coming up really loud and then you're dropping it. I'm sorry, I can't hear you. So
no worries. No worries.
Thank you.
And so our partner, Reich Swan, supporting us around kind of the vegetables. See, they have a motto, vegetables for a healthy future. So they're significant to this. So there's probably a core partnership of about 8. And we're now, as Jon, as we kind of got the message from Jon, now is around, okay, one of the critical questions is, you design this, now how do you sustainably finance it? So that certainly, yeah. So this is quite exciting. This is beyond the kind of, just a healthy canteen. This and also this is a digital overlay. So how do we kind of design a way of families ordering healthy lunches, farmers indicating what produce they have available every 24 hours to bring in to the facility, potentially looking at sort of offering the kind of green bonds, being able to monitor the kind of bio waste that can come into the system. So yeah, that's a bit of a snapshot.
That's great. Thanks very much, Shelley. And I'll be watching the space. It sounds very interesting. Now, we've had another question through, Kerrie, for you from Hermosa. Is there a demand for alternative medicine in the rural communities? And what is the best method to help inform the public of alternative services that will add to preventative care? So it's a bit of a 2-part question there, and you're still on mute.
Yes, there is demand. I can't quantify it at the moment. I know that there's some research around in terms of Australia. We know that 80% of the world, that globally, 80% of people use some form of traditional or alternative medicine. But I could be, I for family reasons, I'm the carer for my partner who has a disability. I only work 2 days a week. I could easily be working 5 days a week. I could easily work 7 days a week. So there is demand, and there's demand. So, and when you look at alternative care in terms of naturopaths, herbalists, but you also look at massage therapists, Reiki, energy healers. So there is demand there. For rural people, there's not necessarily the practitioners. because it's a more challenging sort of way to do things. And the costs are probably similar. So yes, best method to inform the public. I have never advertised. It's been purely word of mouth and Facebook. I do occasionally write an article for one of my local free newspapers. They're really supportive. Every time I write something, they put it up. They never edit it. They just put it up straight away. But that's the only way I do it. And so my Facebook page has grown up to over 400 people following it. I'm sure if I took out ads, if I put posters up around their community notice boards and things like that. So I think it's sort of, and this is partly why having other people involved, I can think of certain ways, but I'm sure there's thousands of other ways that I've never heard of. But word of mouth is a really strong one. I get regular referrals for one of my massage therapists. Funnily enough, they're all the same type of issues. So she's seeing the same types of clients, but she refers nearly all of them on to me. So that's the other way of doing it.
Yep. Thanks, Kerrie. I'm keeping an eye on the chat to see if there are other questions coming through. So if there are, then pop them in there. In the meantime, it's more of a reflection, and perhaps it's a question for everybody really, but one of the questions I have in this area, and Shelley addressed it a little bit there, and Kerrie, I think you've talked about it too, in terms of, for example, the very low prices that you charge because you want to make this accessible to the community, is how do we help to bring about a shift in those services that, you know, if you like, publicly funded services are those that are about increasing access to people who may otherwise be unable to access them. Is, you know, what next? I think, Jon, if you're still on, it would be great. We will try and organise another session with you, because I think for me, that piece about finance is a really critical issue, is how as community members, how as practitioners and professionals, do we have conversations about financial models, sustainable financial models, where practitioners are able to, you know, earn a living wage, and clients are able to access services which are affordable and accessible. Does anyone have that answer?
Can I just jump in then?
Yeah.
So one of the things that I have had to do, or have done, is go around and talk to some of the my other local practitioners, because I see the herb clinics as being, they're called herb clinics, but I'd like, and that's where I now have a trauma counsellor and a massage therapist who will often attend clinics with me. So we're getting that range of practitioners. And that's been one of my challenges. It's like, I'm doing this the way I do because I am in the fortunate position of financially not needing to earn an income. And that's through a whole range of other factors. But the practitioners do. So I've started talking to my local community around the idea of almost like a community-based Medicare scheme. So anything that's not covered through, and I guess because I'm also comparing us to America, where we're a hell of a lot better off than they are in a lot of the states, in terms of the health services we've got available. But yeah, just something that then extends that. So anything that's not Medicare provided, somehow the vision is that the co-op will work around providing that. Now, I also do have clients, one in particular, for example, who, what's your consultation fee, Kerrie? $20. No. I need to give you more than that. Here's another $20 for the next person. So that's been coming up and bubbling up from within the community itself. People with that pay it forward idea of, well, okay, I'll pay you your fee, but I'm also going to pay or give you enough for somebody else's as well. Yeah. And that's also the model around having herbs growing locally and things like that, in terms of what can I do to reduce my costs. So my costs are things like the herbs, the packaging, the postage. So for example, I live on a school bus route. So I've come up with an idea which I'm pitching to the local school bus operators. If I can give the herbs to the school bus operators. They take it to their depot, and then the next one takes it and drops it off at the town library in that town. Because again, we've got dispersed town libraries. So most major towns where the clients are have a library. So what if I can use that way so the transport or the postage is free? So that reduces the cost. By travelling the clinic to the towns, that's reducing the cost of transport for people because we don't have that public transport.
Yeah.
So
that sounds wonderful, and that creative, that collective creativity that I think Shelley was talking about, I see that in evidence there. Another thing that I've been reading about recently, and this your approach there, Kerrie, reminds me of, is, which I'm sure some people will be across, is the asset-based community development approach, so ABCD. And that, I really love that question, and it really made me think of it, Kerrie, when I heard you talk there, which is, what is it that's strong in our communities, not what's wrong in our communities? And that's you doing that in action. Exactly. What assets are there that we can use and connect with? And
that also is part of that health thing. People feel valued for what they can do, not denigrated for what they can't do.
Wonderful. Thanks, Kerrie. And Shelley, I see that.
Yeah, Claire, I just want to add to the around financing. What we're uncovering is all these kind of creative ways, and in looking at the Hepburn Shire, and it's actually the kind of business partners that are actually kind of putting on the table the idea of the Wellbeing levy. That we've kind of seen some experiments around that in other parts of Australia and globally. The idea that you could possibly put a 1% levy on tourism, you come and that's a significant value to a community and to the people coming to that community, because part of what you're investing in that community goes to social purpose. And I think that's quite promising, and that's being modelled. We're about to sort of start to have those conversations. The other thing that I think is really interesting, and are we ready as a nation to deal with in terms of that kind of social market that Jon was trying to talk to us about, social enterprises, social franchise. Are we actually ready to respond to governments and social procurement, which is now being sort of signalled, at least in, I think, 2, if not 3 jurisdictions, as being the future, that there will be that priority on, in fact, government contracts going to social enterprises. So again, I think that's part of that market readiness that we need to be thinking about and responding to. How can we be applying for government contracts? So in a community like Hepburn, why wouldn't this Healthy Lunch Kitchen be responding to the health service, for example, and to local government requirements around catering, to Meals on Wheels? And I think that will be that kind of system shifting that's really quite possible over time.
Yeah, that's wonderful. And I'm reminded again of the kind of the fundamental core belief of NENA, the New Economy Network Australia, is about lots of people doing lots of things in a connected way to then magnify and amplify the impact that we can all have individually. Now we probably have about 30 seconds to see if there's any last minute question, one last question before we then just wrap up and let everybody get on with the rest of their evenings.
If nobody else jumps in, Claire, certainly I know that we should be promoting the fact that your hard work, Claire, in bringing this meeting together means that we're also inviting people to join with Claire and others on this call for the first sort of official meeting of the NENA Health Hub. And remind me, I just typed it in there, it's on the 13th of August, Thursday the 13th of August, at 4 p.m. Perth time and 6 p.m. Brisbane or AEST time. We'll put the details for the Health Hub meeting on the NENA website. Do email us if you get lost and you need to find out the Zoom link for that, or if you've already got Claire's email, do send her a note. And one thing as a final question from me for Kerrie and Shelley, I would love either now or later for you to have a think about how NENA, as a network of sort of different sectors and different people and different groups all across Australia, can be of use to promoting some of the good work that you're doing. Maybe have a think or even answer now how it is that, what can we do together that you can't already do on your own, that NENA might be able to help with in terms of solidarity and support.
I've got a long list. It's been so fabulous to discover that, because you know, doing work that's about system changing is incredibly isolated work. You know, really, and the more complex you get, and the more you know, the more dynamic your intervening gets, it becomes even more challenging. So I think to be part of that I'm really quite excited. I think to be part of that network and to be offering up the case studies of how you actually can do this work, you know, on the ground. That's quite powerful, but not just here's a nice shiny diagram, you know, that looks kind of good, but I think it's about what does it really take to navigate complexity? What does it really take to transform local systems? So I think, you know, being able to be a part of that conversation. And for us, we're a charity, and it's hard times. It is extremely hard times because, you know, partly I think, gosh, why aren't we up and running? Why aren't we delivering our veggie boxes now? That would be useful. And I think the system would see great value in that. Right now, if you're a next layer system transformation kind of entity, you're in trouble. You're in trouble. And you know, so how we generate, how we keep thriving is because, you know, we're a startup. So for us, you know, being able to kind of be part of a network that can drive the conversation, we're experimenting, we're prototyping at rapid speed to add value in this system. So any work and any kind of co-work we can do together, I think, you know, to be part of something is, you know, it's just that would be a great strength, I think, to the growth of social enterprises like ours, of startups that actually are prepared to do that kind of navigating of complexity.
Fantastic. And sorry to keep plugging NENA, but it is a NENA webinar. We have, for example, the co-ops group, the co-ops hub with Anthony McMullen and several others are looking at running a couple of hours co-op clinic in a month or two. We've got the research hub. We'll be inviting researchers from across Australia to share sort of very short summaries of what they're up to across the sector. There's lots of different ways that people can share information, and that we would love for you to share into a lot of those different spaces, you know, and I know that you can slice this work differently. You can look at how you guys work through community-based co-ops and hubs, and you can look at what you do in terms of shifting health systems. So please do have a look across our humble website, and if there's anything you'd like to be part of, or new ways you'd like to share with us, or old ways in terms of simple conversation, please just let us know. You know, we're all volunteers. We get how difficult times are. And if there's anything any of us can do to promote all of you and any of you into the hub spaces, that would be awesome. The only other thing I just wanted to plug quickly, and I might share screen to do it if that's all right, Claire. Oh, no, you don't want to see my emails. That's not at all useful for anybody. Hang on, I thought I had this open. Now I do. Sorry, folks, I know it's late. I'll try again. In August, a number of organisations are running this really awesome week-long webinar discussions, and I'll just flag with you the website. It's right there, beyondcrisis.org.au. The New Economy Network Australia is a supporter, Pingala, the Valley Centre, Australian Earth Laws Alliance, my other group, and it's got a whole range of discussions and webinars. The dates have just been changed, Monday to Friday, the 17th to the 21st of August. And I think it would be great to get some of you folks in the health sector in as speakers as well. So I just wanted to share that with you. You can grab like a week-long ticket for $10 or $15. It's really not about that money. It's about, we've got Indigenous leadership. We've got amazing people speaking about big picture transformations required. Everybody's thinking about systems change at the moment. So this is, I think, very much aimed at helping people see the good stories that are out there. But the main reason I'm plugging it is there's going to be on the Friday of that week a huge focus on the funders, the social impact experts, and all those lovely human beings who float about in that mystical world of philanthropic society and money. Which many of us folks, myself included at the grassroots, often don't get a chance to even knock on their door or access. So I really would urge you all to have a look. The program should be up in the next day or two. But I have been part of helping organise it, and I kept banging the drum for, there's a ton of good work out there. NENA represents the amazing complex network of people doing good work, but how we find the money and the resources to sustain a lot of that. There's only so far people like me or any of you can volunteer before we're a little constrained. So I guess I just want to give that a plug, because we're hoping that that will begin a conversation with philanthropists, social impact folks, and all those other rich buggers, so that they can support the really important work on the ground. So yes, that's all from me, Claire. I'll let you wrap it up now, hey?
Great, thank you. Yes, and Beth already made the start there, so I wonder if you would join me in doing the Zoom thank you, which, you know, to say a huge thank you to Kerrie, Shelley and Jon for your contributions. It's been really wonderful to kind of, I've seen a few comments about how inspiring it is, how hopeful it is, how positive it is. Thank you. Thank you too to Michelle for your efforts at sustaining and maintaining this loose group of willing souls that have a shared vision and creating a space where these kind of conversations can happen. We will send you the information about the next NENA Health Hub. We hope that you will join us at that, and that really is a co-creation space. It's like, what do we want to get out of being together and working in this space? So yes, I think all that remains. Oh, I would just also like to say a huge thank you to Rashmi, Alison and Chris, who have been part of this conversation for the last few months and have gotten us here to this point. So thank you everyone, and we'll hopefully see lots of you on the 13th, and or on the NENA website, and or on the NENA Facebook group. And let's keep up the good work. I'll finish, I think, on the quote from Shelley. Now is the time.
I love it. Thank you, Claire.
Thanks everyone.
Thank you, Kerrie and Shelley and Jon. Good night, everyone.
Good night.